Good afternoon, everyone, and thank you for joining our weekly COVID-19 call. I am Mark Giordano, your CEO. Welcome to this afternoon's call. Last week, I began sharing data with you. I will continue to do so each week so we can together remain focused on the impact of COVID-19 in our community. As of last Thursday, we had 432 cases of COVID-19, including 3 participant deaths within our community. The total number of cases is up from last week by 120, an increase that is reflective of an adjustment to previously reported cases, testing that we are doing at our health centers, but most importantly, reflective of the ongoing pandemic and the need for all of us to continue the safety measures in place. Many states have begun to implement their reopening plans. States are beginning to loosen restrictions, but continuing to maintain social distancing, face covering, and other requirements. This is the case in our Midwest states, as well as Florida, while many of our states on the East Coast, including the Mid-Atlantic and New England states, anticipate much slower reopenings. We understand the desire for many to want to get back to the way things were in February or early March. The COVID-19 pandemic has created uncertain times and resulted in unprecedented workplace changes. Getting back to the way things were means increasing the support to the people we serve, seeing each other again, getting back to work, allowing folks to put food on their table and provide other necessities for their families and loved ones, getting back to the office and away from the new normal home experience. These are all important reasons and great reasons for all of us to want to get back to the way things were. But as we learn more every day about the coronavirus, we know the impact will be long lasting, requiring us to ensure that we continue to have appropriate health and safety measures in place. To that end, we are prioritizing the health and safety of our consumers and employees every step of the way as we consider returning us gradually to our full operations. The committee who is coordinating this effort will rely on CDC guidelines, local, regional, state, and national orders, funder orders, and other recommendations. Thank you to everyone who has provided us insight and feedback that we will use to formulate our plan, and please keep your thoughts coming. We also understand that each employee's needs and situations will be different as our doors begin to reopen. Employees should discuss any concerns they have about returning to work as it relates to their personal health or situation with their manager or supervisor. As we embrace this work together, we will do so with our values of safe and open culture, multi-level thinking, and empowerment of groups leading us. We will create an environment where staff feel safe to communicate their thoughts, feelings, concerns, and ideas. An environment that promotes win-win thinking and process that encourages the expression of many different viewpoints and discourages any one-dimensional thinking. I think we can all embrace the need for us in this time to really embrace multi-level thinking, as well as empowerment of groups, creating an environment where decision-making utilizes the collective thinking of all folks within the organization at various levels within the organization, including the people we support where possible. Embracing our values, embracing these specific values, multi-level thinking, safe and open culture, and empowerment of groups, will ensure that we hear the voices of many as we formulate and implement our plans and return to full operations. It's only together that we will move RHD forward beyond the current COVID-19 pandemic. Today, we have several updates that we will be sharing with you, and we hope to answer your questions that you presented prior to the meeting and during the meeting. And today, we will also be asking you questions. At this time, I would like to pass pass the mic to Sean Mott, who you all know is our awesome facilitator and has been for all of our meetings. Sean?
Thank you, Marco. I appreciate that shout out. So good afternoon, RHD, and for those that are calling from a different coast, good morning. Just a few information updates regarding housekeeping. So as a reminder, the only views that you will see will be that of the panelist. All lines, with the exception of the panelists, are muted. As Marco stated, we use an engagement process for this weekly call. So it's a Q&A at the end or towards the end. You can submit your questions as you're processing through the call through the chat feature. You can also use your voice, or you can use the COVID-19 website email address, which is rhd_COVID_19@rhd.org. It's also important to understand how this process is working. So to that end, we're instituting a quick poll. We will try this for the next few weeks just to see if this and how this process is meeting your needs and getting you information. So in a moment, we're going to launch polling questions 2 at a time. We'll ask that you take the time to complete the polling questions. We're going to use this information to better design and manage this call so it best meets your needs. We will also plan to share the information from the results of our polls at a future call as well. So at this time, I'm going to ask that Brian would open the polling link so that the participants can see the polling questions. There are 2 questions that we're polling. You could take the time to complete by selecting the radio button that best applies to your response. And Brian, thank you for opening the survey polling questions. I'll give you about another minute to complete survey responses, and then we will close the survey poll. Great, and at this time we will close the poll, and as a reminder, we will have 2 more questions towards the latter part of this call as well. Thank you, Brian. So at this time, we'll now pass on to Linda and Brandon, who will share stories from the field. Linda, Brandon?
Hi, everyone. I'm Linda Donovan. I'm the Chief Program Officer for Behavioral Health and Housing Services. I wanted to take a moment today to acknowledge really all of our workforce, our day services, our mobile services, our health centers, our residential programs. Every one of you deserves to be highlighted for the exceptional work that you're doing during these difficult times. Today, though, I want to highlight and take a moment to talk about one of the types of our mobile services, our ACT teams. ACT teams are comprised of a physician, nursing, peer services, vocational, mental health professionals, and addiction treatment services, all in one cohesive service delivery. RHD has ACT teams in 4 states. We're in Louisiana, Iowa, Delaware, and Pennsylvania. And on any given day, all of the programs in those states serve about 1,500 participants. We serve from rural to urban settings and everything in between. And during this time, all of those teams have been in the community, working on telehealth when able to, continuing to serve those 1,500 people. Many of the services I mentioned were able to switch to telehealth, but some of ACT services are not. They're essential and need to be face-to-face. So all of the teams, through creativity and dedication, have been working on the best way to continue to deliver service. So for the ACT teams and for all of our programs, I just wanted to thank you for your service, your courage, and your dedication during this very, very difficult time. And now I'd like to turn it over to Brandon.
Thanks, Linda. And this is Brandon York, Chief Program Officer for IDD Services. And we have a unique hero that was actually nominated by several folks last week in the program, RHD Boston program, and that's Amy Volterra. And I'm just going to read a couple of folks nominated her. And I thought these comments were really great, so I didn't want to summarize it. I really want to read it because it shows you how important it is. And this is a particular topic I struggle with, which is technology. So right now, as we're working remotely, I thought this was very appropriate. And Lisa and Cynthia both shared regarding why Amy Volterra was their hero this last week, actually through this whole process. This woman is a superhero. She has put in so much time, with at first working 90 hours a week in our houses, doing overnights and working herself to death. And now she is partnering with Cynthia and putting together the program that we are doing with individuals involving phone calls and video calls through Zoom in virtual services. That may sound easy, but for some of us, like myself, we are not computer literate. I admit I am terrified of these crazy machines. I just can't get it. Amy is our tutor. She's our after hours teacher. She's on the phone for hours at a time after work hours, helping me or others in doing others in the program, getting on the computer and getting these crazy things to work right. She spends most of her day working and then all evening coaching us and getting us to use Zoom, teaching us how it works, all the ins and outs, and how to access all of the features. If anybody needs anything at all, Amy is always there in an instant. These things, all these things and more are what make Amy a hero to me. I think she deserves recognition and a big pat on the back for what she's doing for this pandemic and all of our people, including homeschooling her daughter. Great work, Amy. You're a hero to us. Thank you, Amy Volterra, RHD Boston. Great work. Appreciate it. I'm going to pass it over now to Jenny Lipinski at our credit union. She has some great news for us.
Hi, everybody. I'm Jenny Lipinski from the credit union. First, I want to thank everybody for your outstanding job that you're all doing for us. And we truly, truly do appreciate you working as hard as you are and doing what you're doing, because you're making it easier for all of us inside here. I do want to just bring a couple things up to remind people that if you're a credit union member and you've been a member for at least 6 months, we do have the COVID-19 loan special. It's going to run through June 30th for $1,000 to help you with some bills. Whether you're furloughed, your hours have been reduced to half, or if you're full-time. The loan is there. If you're furloughed and your hours have been drastically reduced, your first loan payment won't be until July 3rd. So hopefully by then we're all back working and everything will be back to the way we used to have it, which we all liked. Second, I know that people are getting sick or they're out. They might be out. They may not be sick from COVID-19. They just might be sick. You all have insurance on your loans, but if you don't tell us you went out and you don't give us a date that you went out, we can't get you the paperwork, so they'll make your loan payments. You've already paid for that. It's one less bill you have to worry about. So get us that information. You can send the information to Diane and I at tfcu@rhd.org. or call us at 215-951-0329, which is the credit union's number, or my number, which is 215-951-0327, extension 3218. We have the phones on our desks here at home, so we can answer them and we'll get you the paperwork. They'll make your payments. You're only responsible for the first 14 days. So don't waste something that is free to you right now. And also, if you're struggling and you are part-time and you think, oh, I'm still going to try to make these payments and you can't, just give me a call and we can extend your loan payments. But if I don't know you're having trouble, I can't extend them. So our number again, my number again is 215-951-0327, extension 3218, or you can write me at ginny@rhd.org. And we can extend it for you until you come back. And so let's all work together. We want to help you guys. And on the COVID-19 loan sale, if you're a member for only 90 days, but you're with RHD for over a year, you're also eligible. Normally it's a 6-month wait, but we've reduced it for this loan special. So we're here for you. And that's all I have today. And so I'm going to pass it on to Christy.
Hey everybody, I'm Christy Katz-Friedman. I am the Wellbeing Manager. I want to say thanks to all of you who were able to take the time out today to get on the call And thank you additionally for sharing everything you hear with the people who couldn't get on the call. I know last week I said I was thrilled to see how many people were on, and then I was told later that you couldn't see it. So we have close to 300 callers in, but that doesn't mean that there are only 300 on the call, because some of you are sitting with more than one person. And to that end, I'm so thrilled that we're able to bring this information to you every week. So as long as you're not driving, get a pen, because I'm going to give you some information that I want you to write down. But if you're driving, please don't do it. All right, let me get my pictures out. I took pictures of all of this. So every week you get an email, and I know you're getting a lot. So I'm just going to tell you right now, you're getting emails about all of the classes that we're offering for free. We're like the well-being champions of the world, I feel like, because at this point we're throwing so much stuff at you that you have a choice which ones apply and which ones you like and which ones you don't. So let me start off and say that tonight, and this is Eastern Standard Time, I'm sorry, I can't switch back and forth. I am not that smart. So I'm just going straight Eastern Standard Time. Tonight at 5:15, we have yoga. It's really lovely. A lot of you have signed on, and I want to say thank you for those of you who have gotten on and kept your camera on and introduced yourselves, because it's so nice to meet so many people. Unfortunately, it's this way, but I feel thankful that way. Also tonight, we have circuit training. It's super hard. I have a hard time, but it's there, and that's every Monday night at 5 p.m. and then again at 6:30, so you really can't say I didn't have time, because it's twice. And then Martin, the man who brings it to us, also brings it Wednesdays at 6:30, Fridays at 6:30, and say you're a morning person and they don't work, you could take it Saturdays at 9 a.m. There's actually no excuse. And the other thing is, if you sign on and you're doing it on your phone, your laptop, or you know how to Chromecast it to your TV, and again, above my pay grade, but I know a lot of you are doing it, put your family in the room, put your kids in the room, it will tire them out. The other thing that Martin added was kickboxing. How many people want to learn about kickboxing? He is now offering it Saturdays, Tuesdays, Thursdays, Fridays. I don't know when Martin has any other time, because it feels like all he's doing is working out with us. Let me see what else. Oh, okay. Zumba. How many of you have been trying out our own Emily Wiggins Zumba? Emily brings us Zumba every Sunday at 11 a.m. and then she does it again at 6 o'clock on Wednesday evenings. Again, another opportunity. If you don't want people to see you dancing, just put the camera down, put the camera up. I don't know, whatever you feel comfortable with, but now is the chance. Dance like everybody's watching you. Maybe you're like that, or maybe dance like nobody's watching you and don't let them see you, but give it a try. And then I also want to remind everybody that the Cornerstone trainings have been extended till May 15th. Take advantage. They're definitely going to go away. There's wonderful trainings out there. Oh, I know. And the last one is, I know, I'm just stuffing it all out there. Take what you can. Remember your pen, you're jotting it down. If you're not even writing it down, my email is Christy, and it's right there. It's just Christy at RHD. And the last one I want to remind everyone about is our dietitians are on hand. And now you can be in your home, your kitchen, and they will go through your kitchen with you, look at your cabinets, give you suggestions on what to do with what you have and what you might be able to cook up. Again, vegetables are good right about now. I eat ice cream 5 nights a week, and I am trying desperately to stop, but it feels good. And right about now, if it feels good, I'm going with it. I'll manage my problems with my eating later, but for now, I eat a lot of ice cream. And helping hands. Remember, helping hands is always there. And my final thing I want to say is thank you to all of you who go to the office hours being offered through DSIC. I've met so many of you. You've shared so many of your coping strategies, your stories, your families, and how you're working with your participants. And I just want to say what a weird time it is, but I feel more connected to so many of you than I ever have. So continue to reach out, join those hours, and keep it up. We're going to get through this. And now I'm going to introduce Amanda, who sometimes I like to refer to as Demanda.
It's so unfair. So I would like to actually echo Christy and thank everyone who has taken advantage of the DSEC office hours. And it's a great segue to an additional resource I wanted to talk to you guys about today, in addition to one other thing. So some of you know and have joined, many of you know and have joined the DSEC is the Department of Clinical Innovation and Quality. We're the corporate clinical quality team. And I'm Amanda Janulis. I'm also, I'm one of the clinical directors for the Behavioral Health Division and the IDD Division. So for those of you who have been coming to them, right now we have a spread of different office hours that are available during the day for all of the service groupings in your respective programs. But we had to work out a few kinks, and we are now able to offer an after hours time slot for people who just can't join during the day. So it's going to be from 6 to 7 Eastern Standard Time on Tuesday evenings. And your either departmental leadership or your unit director, service line leader will get a link if they haven't gotten one already to join via Zoom to send on to their staff. So you can come as you are. You can come for part of it, you can come for all of it, you can stay as long as you want to. And really what these are, if you're unfamiliar with them, we're calling them office hours, but it's really a kind of a virtual gathering space for people to share how they're feeling during this really challenging time, to share strategies of how folks are managing the workload that we all have from both work and home, a place to vent. And I think most importantly, you know, people are really able to see that you're not alone in this situation. Whatever it is that you've been feeling, I guarantee that there is at least one other person that's going to be in this space that is feeling the same way. So I really hope that folks will join. If you don't get a link sent to you, please reach out to your supervisor, your department leader to get that, or reach out to your clinical director, your respective clinical director to get it. So we hope to see you. Hope you guys will join. So that's one thing. The other thing I wanted to just bring to your attention is related to wearing masks. So for those of you who have joined for the last couple weeks, you have gotten some awesome demonstrations from Rebecca, who is in the health division, about how to wear masks and other PPE. But I wanted to pick up a slightly different aspect of that, which is the challenge of wearing masks for some of the individuals that we work with, both wearing the masks themselves and also the staff wearing the masks. So just knowing that for us who have been inundated with information about COVID and the way that it's spread, and we're seeing it all the time, we're having to keep up with it for work, we're keeping up with it for our families. We have a lot of context for why we're wearing masks. And not only why we're wearing them, but how important it is to wear them. And if you think about the individuals that we work with, hopefully they're not watching as much news as we are. Some news is important, right? Some information is important, but they probably don't have as much context as we do. So imagine that there's this really major drastic change that happened, and it may really feel out of the blue for folks. So it can be super challenging. So there's that. There's the lack of context. But on top of kind of, you know, maybe an unclear explanation or an explanation that makes sense, it can be really, really hard on communication because people can't see they can only see half of our face. So it can be disconcerting for some. And our individuals, as you guys know, who work in the programs, they really, really rely on the communications with staff for the planning of their day, and then just as the day-to-day rollout happens. So it can be kind of jarring for people. So anyway, this is especially true for the individuals that we work with where English is their second language, or if we have folks who are hearing impaired. So that's multiple challenges. And then on top of that, I would be remiss if I didn't also add that, you know, we have some folks in our programs who have medical trauma in their past. And seeing people with masks on can act as a trigger for people. So that just automatically, those of you who have taken the trauma e-learnings, you know that the flood of things that happen for people when they experience something that was stressful or traumatic from their past will really put them on edge and unable to really think clearly and understand what's happening. So knowing all of that, I wanted to share just briefly a few tips that might help lessen the negative impact of this. And I also want to encourage you as I go through these, if there's something that your program is doing or an idea that you have related to this, please add it to chat. We're collecting those things. So, and we can gather that information and share it back out with you. So if you think you have something that might be helpful, or even if you're not sure, please put it in chat so that we can keep up with it. So just a few things. One thing to consider is to reintroduce yourself when you come in. So if you're seeing somebody for the first time that day, or you're coming into shift for the first time, just check in and say, hey, it's me, just so that in case people, you know, they're only seeing half of your face, right? And they don't recognize you right off. And there could be various reasons for that. Another thing that I've seen some healthcare workers do, and you guys might have seen this too, is that they are pinning to their shirt a picture of them without the mask, and then right side by side, another picture of them with the mask, so that people can see the side-by-side comparison. It's a quick visualization that might be helpful. Another thing is to double check to make sure that people heard what you said and that they understand. So not to assume that somebody understands, but to check in, because the fact is, if they didn't understand, they may not know that they didn't understand, if that makes sense. So checking in would be helpful. Another thing, one other tip would be, don't be afraid to exaggerate your head nodding, your other nonverbal cues like shaking your head, you know, using your eye movements and your eyebrows to really convey the emotion behind what you're saying in your tone of voice. Another is, and I talked about this before, but being sensitive to the fact that seeing people wearing masks can really be anxiety provoking for some folks. And that recognizing that, saying it out loud to people can be really validating. Like, this is really, we know that this is uncomfortable and this is unusual. And if folks are comfortable with it in the program or at another time, if people are feeling unsure, to just talk about it together, if people are comfortable talking about it. Two more ideas. And we're hearing about this a lot, and I'm sure that you guys have faced this. If you have individuals in your programs that have been asked to wear masks, we have people who are super uncomfortable doing it. We all know when you've worn them out, it's weird to have something touching your face. It can be uncomfortable, like hanging on your ears. If people have, some of our folks have mannerisms where they're used to touching their face in a particular way, and they can't do that, and that can be, it can be disconcerting when they don't have this they don't have access to this pattern of behavior that they're used to. So again, it is absolutely, it can be scary for staff when the folks that the individuals that they're working with won't wear masks. And that's legitimate, and I understand the fear. I think that a good place to start, if you can do it, is to try to remember first how uncomfortable and scary this might be to ask the individuals that you're working with to wear masks and keep them on. And then I would suggest asking your supervisor to get a team together, a group together, to brainstorm some ideas that might be helpful for that particular individual, because this is, whatever you come up with, it's not going to work for everybody. So some creative solutions for different people, even if you can get somebody to wear a mask some of the time, that's progress, that's okay. And the thing that you can't control is the folks who just won't do it. And there are many legitimate reasons for that. Like I said, what you can control in that situation is your own response, which could be to make sure that you are taking all the precautions that you know to take, distance when you can, wear your own masks and things like that. And the very last thing is that take some time to acknowledge and express gratitude to people who are wearing masks. It's really a big deal, and some words of encouragement and praise can really go a long way. So again, those are just some tips. If you have others that you think might be helpful, please, again, put them in chat and we'll collect those and share them back out. So anyway, I am going to pass it on to Emily. Are you here? Okay, I see her. All right.
Hey, everybody. Just want to start off with a big thank you to everything that you are doing to keep the work going and keeping our patients and consumers safe and yourself safe. So thank you. I'm Emily Nichols, the Executive Director of FPCN. We are testing for COVID-19 at our 3 main Philadelphia health centers, 11th Street, Abbotsford, and Health Annex. We have collaborated with some RHD programs already for testing and happy to support any of you in testing for whoever needs it. So far, we've tested almost 600 people, and we're seeing results in about 48 hours. The easiest way to get on our schedule, just hop on our website, fpcn.com, and call whichever location is most convenient to you, and we'll schedule you for testing, or you can email me at enichols@fpcn.com, and I can direct you to the appropriate person at the site to get scheduled. We will ask for some demographic info, but don't worry about the cost for the test, and we can get you on the schedule pretty quickly. So give us a call, and we're happy to help. Thanks. I'm going to push it back to Sean.
Great. Thank you, Emily. And thank you to each of our panelists for sharing information with us today. We're now at that point where we're about to segue to the traditional time where we open to answer questions that you provided either through the chat feature or through the website email or through your voice. But before we segue to that, we have 2 more questions we want to poll. And again, the purpose is to get an understanding of how this weekly meeting is meeting your needs. So at this time, I'm gonna ask if Brian could kindly open the poll again. You have 2 additional questions before you. I'll allow another minute or 2 to respond by selecting the radio button that both reflects your response, and then we'll close the poll. And thank you, Brian, for opening that poll. We will now close the polling questions and we'll segue to the Q&A process. As a reminder regarding the polling questions, we will collapse that information, and then prior to during the next call, we'll share what we learned and also the process that we will use to respond to that learning. So we'll understand how this is meeting your needs and what we need to do differently. Looking at the Q&A process, we have 1 question, actually it looks like 2 questions that may have come in. The first question is to Stephanie, and it's regarding opening. When our counties open this month, will our consumers be able to have a family member visit their home and go visit at their family's homes, still following all guidelines? Stephanie?
Hello. So what we're doing in terms of opening is a phased approach. Whether or not when we are opening, what we'll be doing in terms of visitation will really depend on the area that you're located in. So you will be provided with specific guidance that will include when visitors would be welcomed into the program and what protocols and guidelines would be required for your specific area.
Great, thank you, Stephanie. And then the second and final question that we have for today is regarding position and role. And it looks like this might be a question for Alicia. It states that I don't know whether CPSs are considered direct support. Are they?
Sean, I'm going to go over to Linda
Mhm.
as the Chief Program Officer for Behavioral Health, which is where most CPSs, I'm assuming that's Certified Peer Specialists. I don't see Linda on screen, but I'm going to kick that over to Linda.
Great,
Hi,
thank you,
everyone.
Alicia.
Hi, everyone. So at RHD, there's many different types of roles for CPS. So some are direct support, some are more in the training, some run groups. So I think it would depend on the program. And if anybody wanted to reach out to me directly at ldonovan@rhd.org, I could help answer that.
Great, thank you, Linda. We have another question that just came in, and this is a question regarding testing. And this is possibly a question for both Brandon and Linda. Is there a plan in place to get tests available for Missouri and states other than PA?
Specifically, we're, in IDD, I'll speak specifically if Linda wishes to add, but we're not seeking tests. We're not a testing center. So only our healthcare centers right now are doing that testing on site. We are not seeking to do that ourselves. So we are not, I guess I would say right at this point, no, we're not seeking to get tests, for a specific site in Missouri or elsewhere to be able to offer those tests. We would encourage folks to go to a testing center that's available in the area. And if folks need help with that, we can coordinate that as leaders to try to reach out to find available testing sites that are in the area to direct folks. But again, not our intention to do that at any of our sites.
Linda, were you going to also add to
Yeah,
that?
I'm
as well?
sorry.
Yes,
Yeah, I was
sure,
just
that's
going to
fine.
say, I would really just echo Brandon's thoughts there, because we have had experience in the different states. Some states have been much more accessible for testing, open for it, have made arrangements. So, but we are not providing testing anywhere outside of the Philadelphia area through the health centers, but are encouraging people and trying to support where there is the need to look for local resources.
Great, thank you, Linda. Thank you, Brandon. An additional question has come in, and this looks like it's a question possibly for Stephanie. And it also appears that it's a question that's looking at the specificity regarding the opening. So in addition to answering the question, Stephanie, if there's any other detail you'd like to add about our process and our considerations for the opening, I think that might help as well. The question is, when we open, how do we do the 6 feet distance?
Hello, everyone. I'll come back at it again. So we are in a wide variety, of configurations, spaces. In some areas, we even have specific rooms, offices that people can go into. So we have a large variety, quite frankly, of approaches that we're going to have to take in terms of opening. So for example, in the chat, someone mentioned an open space environment. How would we distance in that environment? The solution could be adding partitions, or even more likely that we work on a rotating schedule so that we're not crowded in and have enough elbow room to space out. We may in fact use other spaces that wouldn't be typically used for seating or regular work in order to give people the opportunity to spread out. So we will be creative with our approaches. We will be customizing the approaches to the very, very many situations that we have, locations that we're in, and challenges that each of those specific locations will present to us. Hopefully that's helpful.
Great. Thank you, Stephanie. That appears to be all the questions we have in thus far. You may have also noticed a trend. Our last week call ended earlier than the allotted 90 minutes, and it appears that we're trending the same way for this call. I believe this is perfectly okay, and we're also hoping that through the polling process that we instituted today, we'll find out how this process is hitting the mark and how it may be missing the mark, so that we continue to provide information that is most useful. At this time, I just want to check in to see if there's any other closing comments from our panelists before I pass it back to Marco, who will provide us with our closing remarks. Any other outstanding information or any added information based on our discussion today from any of the panelists?
Sean, I just wanted to add and ask everybody, remind everyone to keep an eye out for information on the first phase of the reopening. And if you have questions, once you receive that information, please reach out to your supervisors or safety@rhd.org.
Good. Thank you, Stephanie. Any other panelists offering any additional information before we wrap up today? Thank you again to our panelists for your information that you provided. Thank you to those who completed the poll, as well as participating today. And at this time, I'm going to pass it back to Marco, who will wrap us up for today. Marco?
Thank you, Sean. And again, thank you to all the panelists and the participants who not only asked questions today, but also all of you that have answered our polling questions today. Those questions will really allow us to ensure as we move forward that we're meeting your needs through this town hall discussion as we continue to move forward with working together, working through this pandemic. I want to reiterate something that Stephanie shared as well in terms of really being on the lookout for our phase one getting back to normal plan. You know, I think we're still trying to formulate what we're calling it. And also encourage folks to continue to provide us your feedback and your insight and your thoughts and ideas, as well as your questions, so that way as we develop that plan, that will begin to speak to all the various services that we provide and the types of locations we provide them in that we're considering as much as we can up front. I want to thank everyone, and again, on behalf of the full panel here, thank all of our staff for what you have done during this past two-month period that we've been working together under these difficult, unprecedented circumstances. So I really want to thank everyone for their commitment and their support that all of you have provided, either directly or indirectly, to each other, as well as the folks that we serve. We all very much appreciate all that you're doing and look forward to us getting back to what we know is different than what is going on today, but also probably different than what we had experienced in February and March. I want to just sort of plug our new What's Up RHD video, which is due to come out tomorrow. It is showcasing our own Rebecca Bixby, who is demonstrating PPE. So I know many of you responded to us as part of this call, how informative that was. So please share that with your coworkers and point them to the What's Up RHD video that should be out tomorrow. So hopefully folks will have an opportunity to share and watch that as it becomes available. The last thing I really want to mention and really end us on maybe a little humor, but also stressing the importance of what we're doing and why we need to do it. And I think many of you out there know today is Star Wars Day, May the 4th. And what I ask everyone to do is, as you're grabbing your lightsabers, grab your life savers, those masks, those face coverings, and help us together manage the spread of COVID-19 within our community. So thank you all for all that you're doing, and I hope you'll join us on our next call. Have a great day, everyone.